Is there any way I can like flip this? Like, I don't want to. And how do I continue with the slides?
You can use this forward, backwards. Okay. Our next presenter for this session is Kyyah.
Okay. Hello, my name is Kyyah Simon, and today I'm going to be talking about the impact of inadequate sleep on mental health. So during my research, I found that 66% of individuals were misdiagnosed with major depressive disorder. And additional to that, 71% were misdiagnosed with general anxiety. These statistics that I am bringing to your attention include the individuals diagnosed with the wrong mental health disorder, no mental health disorder at all, or have like other underlying problems. Okay. So the purpose of my research was to examine the impact of sleep on mental health in specifically BSN college students. This is important because sleep, whether quality or quantity, and quantity meaning the hours of sleep, plays an important role in one's creativity, cognition, memory, physical well-being, and most importantly, their mental health. Okay, let's see. So before I proceed, by a show of hands, how many of y'all get less than 8 hours of sleep per night? Wow, okay. That shows why this is important. So those of you who raised your hand are obtaining less than the recommended of 8 hours of sleep per night. This can lead to an increase in mental health illnesses, not only in college students, but in the general public as well. And of course, this is going to be over a specific period of time, not just if you do it once a night in a week. Majority of adults receive less than the recommended 8 hours of sleep due to factors such as stress, workload, and their sleep environment, such as like maybe loud family members at home, or even scrolling on your phone, on Instagram, social media, anything like that before you go to sleep. So by show of hands, how many of y'all stay up just scrolling through social media? Yeah, okay. So the part of the brain that controls the sleep-wake cycle and body functions are disrupted in individuals not getting more than 8 hours of sleep, as well as those diagnosed with depression or anxiety, which is why these two concepts are related. This is why educating patients on ways to promote adequate sleep or providing enhanced screening measures during hospital visits will prevent mental health issues in the future. Okay, so for the next couple of slides, I will be talking about my articles that support my previously stated research question. Article 1 consists of a 926 sample size where each participant was provided a 12-question survey which screened for mental health illnesses such as anxiety and depression by asking questions pertaining to sleep, eating, or even if they were having any experiences with sadness, tension, or stress. These specific questions were scored on a scale of 1 to 5 and then averaged based on those who sleep less than 8 hours versus those who don't. Those scoring closer to 5 were considered to have a higher risk of developing common mental disorders. Additionally, those getting more than 8 hours of sleep are considered to have good sleep quality, and those who obtain less are considered to have poor sleep quality. Of the good quality participants, they averaged a 1 out of 5 risk of developing common mental disorders, which will be preferred to or referenced as CMDs for the remainder of this presentation. Additionally, those with the poor sleep quality averaged a 4.6 out of 5 for their risk of developing CMDs. This finding indicates that lack of sleep is associated with mental health disorders. As the lack of sleep increases, so does the risk of CMDs. Additionally, risk of CMDs will be decreased by improving sleep quality and decreasing daytime sleepiness. My second article examines the relationship between sleep, mental health, and sleep debt and daytime sleepiness. Sleep debt meaning the difference between the recommended and actual amount of sleep an individual gets per night. The sample size of approximately 2,200 university students were surveyed for hours of sleep per night on a scale of only 5 to 11 hours. So those who obtained more than 11 hours of sleep or less than 5 were not really included in this study. They were scored on their anxiety on a scale of 1 to 10, and then depression on a scale of only 0 to 3. 70% of this sample size got less than 8 hours of sleep per night. And of this 70%, 1 in 3 were considered to have a high risk of developing depression, and 1 in 4 for developing anxiety. This study resulted in the college students who get less than 8 hours of sleep a night have an increased risk of anxiety and depression. Article 3 sought to investigate depression and other determinants associated with excessive sleepiness, also referred to as EDS, during the day using a sample size of roughly 2,600 college freshmen. 27.1% of this sample presented with excessive daytime sleepiness with an average of 6 hours of sleep per night. Additionally, the study summarized that symptoms of psychological disorders are linked to disturbances in neurotransmitters, which interrupt sleep quality and increase those EDS. Not getting adequate sleep can lead to poor health habits, which in the long run can develop into mental health illnesses such as anxiety and depression. So for my fourth article, it examines the relationship between stress, depression, sleep quantity, and quality. Participants of a 440 sample size of college students showed signs of anxiety or depression when averaging 8.4 hours, which is above the recommended 8 hours of sleep per night. Additionally, 33% reported some degree of sleep onset insomnia. This study resulted in insisting that sleep quality rather than hours of sleep puts college students at risk for depression, simply because those who did sleep more than 8 hours a night still experience mental health issues. So my final article used a 19-question online survey amongst the sample size of 183 college students to identify the common symptoms of sleep deprivation and mental health illnesses. In addition, it identifies what percentage of the sample size experiences those symptoms depending on the hours of sleep they got at night. In the study, 4.5% of those who obtain greater than 8 hours of sleep experience anxiety and unreasonable sadness. 33% who obtain 6 to 8 hours experience these symptoms, and then 45.5% of those who get 4 to 6 hours per night. These statistics show that the least amount of sleep you get, the higher the percentage of experiencing anxiety and unreasonable sadness, which is a symptom of depression. To conclude the study, they stated that the sleep deprivation can prevent as unreasonable sadness, lack of concentration, irritability, and negative self-criticism emotions, which are also signs of mental health illnesses. Additionally, they concluded that poor sleep could lead to psychosocial distress, such as depression, anxiety, reduced physical health, and increased use of any type of substances such as alcohol or drugs. So based on the result of all 5 of my articles, 8 hours of sleep is recommended for the average adult per night. Sleep quality and sleep quantity are 2 important factors that contribute to the risk of development of health issues because of its effects on the brain. Inadequate sleep and mental health are bidirectional, meaning that one affects the other and vice versa. And then this research topic can be integrated into nursing by teaching nurses how to adequately observe signs and symptoms of mental health illnesses, provide adequate education of signs and symptoms of inadequate sleep, making sure nurses are educating patients on the quality of sleep and not only the number of hours they sleep per night. And then lastly, effectively evaluating patients before collaborating with providers or even advocating for patients when diagnosing them with mental health illnesses. We can teach patients to avoid phone use before bed. So those who raise your hand for that question, or even light candles, listening to relaxation sounds, and trying to prevent like going to the bathroom in the middle of the night. So just even going right before you go to sleep will make a big difference in the way you sleep at night. You can even shower before bed, take a hot bath to get your body relaxed, or meditate, or for college students, if you have to read and study, you can read before going to bed. These sleep interventions can help improve the quality or quantity of sleep. Any questions? Okay.